Welcome to the Birth Experience Podcast. I'm Trish Ware, a longtime labor and delivery RN turned online birth educator / virtual doula. I've had the amazing privilege of delivering many babies in my 16 plus year career as a labor and delivery nurse. And as a mama of 7, I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby, and write the birth story of your dreams. So hit subscribe and let's replace your anxiety and fear with complete confidence. Quick note, this podcast is for educational purposes only and does not replace your medical advice from your provider. Check out our full disclaimer at the bottom of the show notes. The last week or so, I have gotten so many DMs and questions about providers, whether it's my provider's doing this and what can I say, or I just found out I'm pregnant and I want to choose a provider. Should I get a midwife? Should I get an OB? How do I go about doing this? And so I thought today we would do just a short little podcast. Well, I'm saying short, but I'm in a mood, y'all, and I might get a little bit talkative, so forgive me ahead of time. But I'm going to try to keep this short and sweet and to the point. But if you follow me over on Instagram or you're one of my students, you already know that I have a hard time doing that. So back to the topic, choosing your provider. I want to say, first and foremost, as a labor nurse, I cannot scream this loud enough that one of the most important choices and most powerful choices that you're going to make during your pregnancy is choosing your provider. This will directly impact your birth story. You need to have a provider that you can relate to, that you can trust, someone who's competent, and someone who really takes the time to listen to you and respect you and honor you. Now, they may not always agree with you, but if you have a good relationship with them and you trust them, that's going to make it a lot easier when those little things happen during your birth where you have to make a different decision. So, the first thing that I want to say to you is to sit down and look at the different types of providers. So, we've got midwives and we've got obstetricians. Midwives are taught the holistic approach to pregnancy. They're looking at the whole woman. They look at pregnancy as a natural process, hint, hint. It is. And they look at you as healthy, that's having a life event. Obstetricians, on the other hand, are medical providers. They're surgeons that are trained to look at it as a medical procedure. Now, are there midwives who treat it more like a medical procedure? Hell yeah. And are there OBs who are more like a holistic midwife? Hell yeah. So you really just want to find a provider that syncs with you. One of the things that I tell the mamas who send me DMs and my own students, because I have a lot of students who are trying to conceive or are very newly pregnant, I tell them to go and find out from the horse's mouth. What does that mean? So what I mean there is talk to moms. Sorry, I'm not implying that we're horses, but it's a saying. So you want to go and find out from other moms in your area. One of the best ways you can do this is to find like a Facebook group for moms. Here in Nashville, we have the Nashville Moms Group, or you might have one in your small city or what have you. Go into a moms group. I know some of you guys aren't moms, so you may not be in the moms group yet, but go ahead, request to join, get into a mom's group, introduce yourself, tell everyone that you're newly pregnant or you're thinking about getting pregnant, and ask for honest opinions. You have to figure out what's important to you, though, because to some moms, an unmedicated, unpressured birth is not a big deal. To other moms, they want to go unmedicated, they don't want to have interventions. So you really have to figure out what is important to you and then really listen to what these other moms say and then pick out a couple of those providers and do an interview. You absolutely can interview a provider. I am not talking about while you're laying on the bed with your feet up in stirrups for a pap smear. I'm talking about across from a desk, two humans talking to one another. You can ask these moms about their experiences as well. So have a list of questions. Ask them, what were they like during the appointments? Did they rush in? Did they rush out? Did they spend time with you? Were they friendly? Were they respectful? Did you feel valued when you asked a question? Did they listen to you or just dismiss it? Did you have a hard time making appointments? Did you have to see a ton of different providers, or were you able to schedule with one or two? When you were admitted to the hospital, what was the experience like with your provider? Did they come see you? Did they pressure you into things that you had already told them you didn't want to do? Were they encouraging during your labor, during your birth? Did they talk over each step, each decision, or did they just say, this is what we're doing, or imply that you really didn't have a choice? Remember, you have a right to make informed decisions. So I'm going to go through a handout that I have, and you guys can grab it for free at the end of this podcast, and we will send it to you. And it is an interview questionnaire. I guess yes, it's an interview questionnaire because you have the right to ask these questions. And if you go in with interview questions, this provider is going to know that you're not messing around, that you're educated, and that you're making a decision based on the answers. So print it out, take it in with you, and sit down and ask them these questions. So let's go through some of the questions. And then, like I said, you guys can grab it after the podcast. We are hosting a free 5-day online event educating expectant mamas on proven ways to ditch their fears of labor and losing control so that you can work with your body, not against it. Will I be able to handle the pain? What if I tear, poop, or need a C-section? How can I make sure the care team listens to me? As moms-to-be, it's completely normal that our minds become filled with so many what-ifs as the big day approaches. But here's the problem. Fear produces adrenaline, which slows your labor progression and works against oxytocin, that feel-good, labor-encouraging love hormone. The solution to combating all that fear and adrenaline? Education and understanding. That's exactly what 5 days to a fearless birth experience offers. You can join us, led by me, a seasoned high-risk labor and delivery nurse, and our team doula, Taylor. Here's what you can expect. 4 live trainings, a 15-page downloadable workbook plus worksheets sent to you every single day of the event, access to our pop-up Facebook group, which will only be active during the event, daily giveaways and aspirations, plus live Q&As and the opportunity to join our VIP experience. Make sure you join us. Click the link in the show notes. We can't wait to see you inside. All right, so let's start with some just basic. You're going to have to find a provider that takes your insurance. So that's pretty important unless you're doing self-pay. Once you figure out providers that take your insurance, the next step is which hospital do you want to deliver at? Now, you could go the other way around and pick the hospital and then find providers that deliver at the hospital that you want to deliver at and that your insurance covers, and which providers take your insurance as well. Another question to ask a provider is, how long have you been doing this? There's like a good reason to have someone who's been doing it a long time. And there's a good reason to have someone who's new. Someone who's been doing it a long time knows their stuff. However, They may be stuck in some antiquated practices. Someone who's new and fresh and excited is going to be a little more apt to try things and be more creative. However, they don't know their stuff as well as someone who's been doing it a long time. So there's good positives to both and negatives to both. Now, remember, you're going to ask, who am I going to see? If I make appointments, will I see you? Will I see all the providers? Ask them if they have a midwife in their practice if you're talking to an OB. A lot of times OBs will have midwives who will see the lower risk patients, and then you fall back to the OB if you are deemed high risk or something unusual happens. Ask them about the appointments. What are they going to look like? How long will they last? What will we be doing? Another really important thing to know is, what are their cesarean rates? What are their assisted delivery rates? That would be vacuums and forceps and episiotomies. Ask them what their view on an episiotomy is. How often do you do them? Ask them how they feel about unmedicated birth without any medication, without an epidural. If they scoff or they roll their eyes or laugh and make negative comments, that might not be your person if you want to have an unmedicated birth. Ask them specifically, do you prefer an epidural? And if I don't choose an epidural, are you going to support me? Will you support me moving during labor? Will you support me having intermittent monitoring? Intermittent monitoring is where we only monitor the baby maybe 20 minutes out of every hour or whatever the order might be. Will you support movement? Can I get up and move around? Can I walk the halls? Thank you, COVID. Hopefully we can do that again. Ask them what their induction rates are. Would you believe that 40% of women are either induced or offered an induction? What are their induction rates? This is really important, especially if you don't want to be induced. Ask them about going past your due date. What's their feelings? If they say something like, oh, well, we don't let our patients go past 40 weeks, then you might want to think about that, because it's not really what should be happening. I have strong opinions about this. Y'all know this. How do you feel about me using a doula or having a support person? Watch their expression, watch their body language, especially if you want to have a doula. The thing is that whatever you talk to them about, they should have good attitudes and be willing to listen and support the choices that you make. Ask them about delayed cord clamping. How do they manage the birth of the placenta? We've talked about monitoring. Do they offer wireless telemetry monitoring? And how often do you use it with your patients if they do offer it? Remember, if they offer something that you really want for your delivery, ask them, how often do you do that? If you're a mom who's had a cesarean and you want to have a VBAC, talk to them about their VBAC rates. If they say, oh yeah, I do a lot of VBACs, well, how many of them are successful? Ask deep questions and have an open dialogue. Ask, what if I come into labor and delivery, I'm in labor, I'm contracting, are you still going to want me to be on Pitocin? This is a big one, y'all. Pitocin, Pitocin, Pitocin. Okay, this one is going to be the test of all time. Ask them if you can push how you want. Will they support that? Will they support you pushing in positions other than lithotomy? And tell them, hopefully you know this already, that you're not willing to push in lithotomy. Watch their reaction to that one. If they say, well, everybody has to push in lithotomy, it's safer, then I would suggest you say thank you so much and leave. Ask them pain relief options that are offered at their birth facility. Ask them about IVs or saline locks. Are they okay with you just having no IV if you stay hydrated? Or can you have a saline lock, which is just an IV site that doesn't have fluids running? Talk to them about cesareans. What if I end up needing a cesarean? Can I have a family-centered or a gentle cesarean? Do you offer clear drapes? Can I play my own music? Can I do skin-to-skin in the OR? Ask them what happens if the baby is breech. Will they try other options? Will they think outside of the box? Now, if you're willing to do a vaginal breech delivery, if your baby's breech, ask them if they do that. Not a lot do. Ask them if they'll support you having a long labor and not rush you into the OR, into interventions. There's lots of different questions that you can ask to prepare for the birth journey that you want. What I tell my girls inside of the VBAC lab and Calm Labor Confident Birth, which is our birth class for everyone. The VBAC lab is for my moms who want to have a vaginal delivery after a cesarean. So if you're listening right now and you're past the interviewing a provider, but you're like, oh shit, I should have asked these questions because I can already tell that my provider is going to be a turd and not listen to me and not respect my decisions. And I didn't know to ask these things. That's okay. That's fine. What we tell our students is you ask them now. So if you're like 20 weeks, 24 weeks, 28 weeks, 36 weeks, and you go in and you start asking some of these questions and your provider is like, oh, we don't need to think about that right now. Let's talk about it later. That's a bad sign, girl. He's putting you off. You want to have the dialogue. Insist on having the dialogue. You have a right. You are paying them. You are hiring them. You have a right to know their feelings about really important decisions that need to be made during delivery. So my recommendation to you is to start having those dialogues now. Ask the questions now. Be insistent. Be respectful, be calm, don't get emotional. This is another thing we tell our students when you have these conversations or they bring up something unexpected, you don't have to get an emotional reaction. If it's an emergent thing and you have to make a decision right then, that's different. But if you're 32 weeks and they're talking about induction at 39 weeks, girl, ask for some studies, ask for some reasons why. If they say, well, it's been shown, blah, 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 say, okay, can you go print that study so I can take it home and think about it? Then, if you're one of my students, come to our weekly hangout and we're going to dissect it. But take your time, go home, read it over with your partner, with your coach, with your doula, with your birth class instructor like me, and think it out loud, talk it out, work through the emotions, and then go back to your provider the next week and have an open dialogue. If it's not what you want to do, if you don't have peace about it, you have rights. Now, I tell my girls you can say no to anything you want and yes to anything you want. It's your delivery, but you want to be educated and you want to make wise decisions. So I hope this little shorty helped you guys today. If you have any other questions about choosing a provider, be sure to either follow me on Instagram, labor.nurse.mama, shoot that question, or join into our free Facebook group, Birth Queens with Labor Nurse Mama. Or better yet, join one of our birth classes and hang out with me. Every week we hang out live via Zoom. Have a fantastic day. And remember, if you want the provider interview download, go ahead to the show notes and click the link and you can grab it for free. Have a great day and a fantastic weekend and an empowered birth.